Our guest is Dr. Tuyi Mebawondo. He is a public health specialist. Good morning, and it's glad to have you on the program.
Yeah, good morning. Maybe we need to raise our voice a bit so that we can hear ourselves clearly.
All right.
Good morning. Thank you for joining us.
Thank you for having me.
Right. So we're having a conversation around tuberculosis, and just for a proper understanding, you're a public health specialist. What exactly is tuberculosis? What are the causes of tuberculosis, for a start?
Yeah, tuberculosis is a disease caused by a germ called Mycobacteria tuberculosis. Okay? There are many types of Mycobacteria. Mycobacteria tuberculosis causes tuberculosis. Mycobacteria lepra causes leprosy. So they are the same family. They cause disease differently. Tuberculosis, in majority of the cases, 80% of the cases affect the lung. But tuberculosis can affect any organ in the body. Okay?
Right.
It can affect the abdomen. It can affect the brain. It can affect the bone. It can affect the reproductive system. So tuberculosis is a very concerning illness, because if you look at the burden of tuberculosis right now, the world has about more than 10.4 million cases of tuberculosis. Tuberculosis in 2023 is the leading cause of death as far as infectious diseases are concerned. It kills more people than HIV. And you can be rest assured that even what we are now getting is what we consider a resistant strain of tuberculosis, which drugs cannot cure, which is difficult for drugs to cure.
Right.
Unfortunately, tuberculosis can be prevented, it can be cured.
Okay.
Why we have this large body of tuberculosis is still a problem, because a single positive case of tuberculosis can infect 15 persons before a day or time.
Right.
So you can imagine, if you have 1 million cases of tuberculosis or 3 million cases of tuberculosis, imagine the number of people that have been infected in a day. Okay? So, and then if you come back to Nigeria, tuberculosis, kills as many every day. Tuberculosis kills as many as 260 people every blessed day. In Africa, it kills as many as 230 people. Nigeria is the highest. 260 people die from TB every day in this Africa. So you can imagine why the disease is so important.
Very true. All right.
Also,
Okay. Please go on.
Also, if you look at the conditions that tend to, facilitate tuberculosis illnesses, if you look at those conditions, tuberculosis has a cooperation with some diseases. HIV and tuberculosis are partners in crime. Unfortunately, Nigeria is also a busy country with cases of HIV. Malnutrition and tuberculosis work together. The more your immune system is depressed, the more likely you are going to have a fatal form of tuberculosis. Nigeria is leading in malnutrition. Overcrowding, poverty, displacement, these are factors that help to spread tuberculosis.
Okay, Dr. Tuyi. Yeah, let me come in for a bit because of our time. We have given a background, a very broad background to tuberculosis and, the causes and the numbers and all of that. But how can Nigeria as a nation address the gap between the diagnosis and the treatment, particularly in rural and developing and underdeserved communities?
I'm not hearing you very well, because I guess you are asking about symptoms and treatment of tuberculosis.
Yes, how Nigeria can address the gap between the diagnosis and the treatment, especially in rural communities.
Excellent. One of the major challenges of getting to cure tuberculosis because part of the SDG is to end TB by 2030. I want to start with one of the goals of the nation is to end tuberculosis by 2030. Now, one of the major obstacles is actually lack of detection. There are more than 500,000 tuberculosis cases in Nigeria that we are not picking. We need to pick those tuberculosis. In order to pick those tuberculosis, we need to really get human beings, trained human beings, and then we need to assess diagnosis. Tuberculosis will be a bit difficult to diagnose. We need to do training for those people and assess diagnosis. We need to step up surveillance. We need to put money to cater for cases of tuberculosis. So in Nigeria, apart from addressing those social problems, like these are risk factors, poverty, overcrowding, malnutrition, HIV, drug, alcohol, smoking, and poor social hygiene, still, we need human resources, we need money, we need diagnostic, we need surveillance. These are critical issues that we take against controlling tuberculosis in Nigeria.
All right, thank you very much. Now, you mentioned that it's quite difficult to diagnose tuberculosis. So my question now is, how can the government step in? What can be done? Are there any symptoms, signs and symptoms? Could we have some form of health check in public places, especially airports, even in schools, to help us? I remember during the COVID era, we had this machine that will check your temperature before you enter any public space and all that. So what do you think? What can be done?
Yeah, it is to be such that these days you need to do a chest X-ray. You need to do what they call a massive test to check tuberculosis because of the danger or spread of tuberculosis. People want to be sure that as you are entering school, you are coming to the house, you are entering institutions, whenever somebody is entering correctional centers, one you must check for tuberculosis. Of course, these are proactive measures to detect the disease and cure it as soon as possible.
Okay.
But you can still be tricked in the sense that tuberculosis can be mass and you will not see it even when you do those tests. Now, you can look at what are the common symptoms of tuberculosis. A cough that any cough that is lasting more than a week if you investigate. People say 3 weeks, but again, even for me, every cough lasting more than a week should be investigated. And the simple investigation is to take specimen of the cough and look into it. There's a special test you call genus expert. Weight loss, when the person is losing so much weight, you have to find out why the person is losing so much weight. The person may not actually cough. Okay? Fever. This fever usually was at night. Night fever, night sweating, these are some of the clear-cut symptoms of tuberculosis. Chest pain. If you don't be chest pain, then you need to check whether the person has tuberculosis.
Okay.
The protocol of signs and symptoms are there. The tests to be done are also there. But at the end of the day, we need to engage trained people to get those things done.
Dr. Tuyi, just before we wrap up with you, because we've exhausted our time, just very quickly, there's a very important segment of this which has to do with the stigma that comes with those that have tuberculosis because they are segregated from the community. So I would like to ask, what strategies, in less than 1 minute, if you can respond to this, what strategies have been adopted to help manage the stigma that people that have tuberculosis deal with?
You are asking about what sector people that have been affected or what?
The people that have been affected with tuberculosis, there's a stigma that comes with it. There's a way they are segregated. Yes, stigma.
Okay. Stigma.
Yes, please.
Okay. How do you eradicate stigma? Okay.
What strategies have been better used to manage it, not eradicating, to properly manage it?
Now, if we dispense information appropriately, we can be able to deal with stigma. Because tuberculosis is curable and preventable. And you can have total cure once you take the drug as stipulated for about 6 months. So TB is curable, TB is preventable. So let us get that one straight. Okay? Once you've treated the people, and in fact, when you commence treatment, by the third week, the person can actually interact with people because sputum becomes negative around the third week. Now, we have to keep talking. When you don't inform people what is possible, then stigma comes about. Now, unfortunately, at the early stage of tuberculosis, you have to separate the corpse so that the person does not transmit disease. But after third week, the person is safe. So, education will be a very powerful tool to use to fight stigmatization. Leaflets, posters, radio, TV discussion can help us to understand why we don't need to stigmatize people with tuberculosis. Because if you stigmatize, a lot of them will run away and you worsen the case for everybody.
All right, thank you very much. This is a safe place to learn. Thank you very much, Dr. Tuyi Mebawondo. We really appreciate your time and your thoughts with us.
Are you there, Dr. Tuyi? Thank you for joining us.
Yeah, thank you. Thank you for having me. Thank you.
Thank you very much.